Welcome to the College Connection podcast, a podcast presented by the College of Registered Nurses of Newfoundland and Labrador. This is the College Connection podcast.
Welcome to the College Connection podcast. The College Connection podcast is made available to registered nurses and nurse practitioners as a resource to promote good practice and to highlight the importance of regulation in healthcare. My name is Kelly Kane, and I'm a registered nurse and a nursing consultant with policy and practice at the college.
And I'm Michelle Carpenter. I'm a registered nurse and a nursing consultant for policy and practice at the college as well.
We have a great show for you today as we have a conversation with Newfoundland and Labrador Health Services CEO, Dr. Pat Parfrey. Hello, Dr. Pat Parfrey.
Hello, Kelly.
Thank you so much for being here with us.
No problem.
Please, can you take a minute to introduce yourself to the audience?
I'm Pat Parfrey. I was a kidney doc. Now I'm the CEO of NLHS Services, to my surprise. And I was the co-author of Health Accord NL with Sister Elizabeth Davis, and for 32 months, Deputy Minister of Health Transformation.
Thank you for that. Dr. Parfrey, on January 23rd of 2025, the provincial government announced that you would be appointed to the CEO for Newfoundland and Labrador Health Services. Could you provide us an overview of your work and positions that you've held prior to assuming the role of CEO? I know you just said a few, but I know you got a very extensive background. So could you enlighten the audience on a little bit about you?
So I came to Newfoundland in 1984 with my wife, who was a pediatric radiologist and was a nephrologist and internist at the Health Sciences Centre since then. And of course, I went through the various leadership positions, etc. I was an active researcher and very interested in patient-related issues that occurred in patients with kidney disease and in patients with genetic disease.
Okay, yeah.
And I had an interest in getting the right treatment at the right time to the right patient.
Absolutely.
And that became we got a CIHR grant called SPORE to be able to do this, and we created quality of care. And quality of care set the agenda for the Health Accord and provided the Secretariat. And the Health Accord then was a plan to improve health in the province that could be summarised by saying we need to increase awareness and act upon the social terms of health, and we needed to rebalance the medical system across hospitals, community and long-term care within the fiscal framework budget of the province. And that accord was agreed upon by the political parties and the unions and the health leaders and the medical school, and the public were involved in it as well. So that then, when it was published, went to government for approval and went through cabinet, and the actions that were outlined in it were accepted as government policy. So then I was hired as a deputy minister to try and influence the implementation of these actions.
Right.
And then very recently, I was asked to be the CEO to help implement them further in the healthcare system.
Right. And Dr. Parfrey, I'm not sure if you remember, but my first interactions with you was through Quality of Care NL, as we brought nurse practitioners into, receiving campaigns from Quality of Care NL and their individual prescribing behaviors based on the campaign.
And Dr. Parfrey, you did talk about the Health Accord. And, one of the pieces of the Health Accord was the restructuring of the 4 regional health authorities into one provincial health authority, NLHS, which you are now the CEO for. Since taking the position, what has been one of the most surprising aspects of how NL Health Services functions?
Well, the vision was that the Provincial Health Authority would act upon the idea that every person in this province had equitable access to the services that are provided by an NLHS service. That's the vision. Mm-hmm. And to do that, you needed to have a provincial vision. But there was also believed that the delivery of care should occur in regions, because the people in those regions, particularly in Newfoundland and Labrador, deserve to have an input into the care that they're receiving. So the challenge then was that you had the capacity to create provincial policy, and on a regional level you had the challenge to be able to deliver the care according to that policy. And it's a challenge because we're used to independent regional health authorities, and now we're asking them to function as function as one. And I think that that challenge can be met by a kind of a different approach to the way we work. And by that I mean we need a matrix structure so that the people involved in the provincial approach are connected at the hip to the people who are delivering the care in the regions, and that you needed dual reporting, that you needed to have reporting up the zone to the chief operating officer, but you also needed reporting up the ladder to the person who's responsible at a provincial level. And then you needed a collaborative leadership so that the people in the zones collaborated with the people in the provincial way, and the collaboration was really the important thing. And for people in a hierarchical structure, the way medicine has been, it's a bit of a challenge. So we're working through that to trying to ensure that we got an approach, a provincial approach for all the major actions of the health accord.
So talking about that vision, what would you say are some of the, I guess, challenges or barriers that would prevent NLHS to fulfill that vision of NLHS?
Well, I think the first barrier would be that if each region thought of themselves as a regional health authority,
Okay.
and that they were going to make independent decisions in their region about what should happen in their region, that is a barrier. And of course, it would be predisposed to by the fact that it was a regional health authority previously.
Right.
And then the other one is you've got this new entity, NL Health Services, coming into that environment where we had 4 regional health authorities, and now we've got 5 zones actually.
Right.
So, and then the other challenge is how you manage a structure like that, because the key thing is the delivery of care and the management of the delivery of care in the zone. But then there is the kind of strategic management then that's necessary, which that's where the collaboration in leadership is required at a senior level.
And Dr. Parfrey, how is, I guess, those within the healthcare system and your employees, how is that vision being shared with those individuals?
Well, we're clearly dependent on the success of those structures that are put in place to have a provincial approach, and they revolve around provincial programs like cancer care and cardiovascular and stroke care and imaging and diagnostic imaging and laboratories and pharmacy, those type of provincial programs, where you've got a degree of budgetary control and a degree of a capacity to tell a region you got to do this. So it's a stronger type of a thing.
Yes.
But then we've got what we're calling strategic health networks, which are in effect a connection across the 5 zones in resolving common problems.
Right.
So an example of that would be one that we're depending upon quite a lot is family care teams.
Right.
So we've got 5 zones delivering care through multiple family care teams, all of which have got different problems, all of which have got different types of providers.
Right.
And you do need a common approach to be able to ensure that the family care team works equitably for everybody in the province. But of course, when you've got different people in different zones, they could tend to do whatever they felt like.
Absolutely. That's right.
So then we feel that the best way to deliver that care and family care teams would be have a provincial policy, a director for the family care teams at a provincial level, who would connect with those 5 directors for family care in the zone, be connected at the hip, then work out how they deliver that care in that family, the family care teams they're responsible to.
Right.
And then at the same time, the zone will be responsible for recruitment and the building and the human resources and all those types of things that are additional to the delivery of care. So you'd think that the policy and delivery of care will be determined at a provincial level, but the delivery of the program will be determined at a regional level.
Okay.
And it depends upon collaboration.
Absolutely.
So if one of the dyad, one of the people in the matrix decides that they want to be the decision maker and don't take account of the other one, it fails.
Absolutely, right.
And then if they work their way through making decisions, and if they can't agree, they move it up the line to the next group, the
Right.
next dyad, so to speak. And if they can't make a decision, it goes up to the next. And then if they can't make a decision or just agreeing upon a decision, it comes to me.
Right.
And then proper leadership would determine that you determine the best outcome that you think would happen and make a decision, and then they have to put it into effect.
Absolutely. So, Dr. Parfrey, for our listening audience, you talk about 5 zones because we knew that there was 4 regional health authorities. So, can you just tell us for the listening audience, what are the 5 zones?
So you've got Eastern
Right.
Urban,
Right.
and then you've got Eastern Rural. That's the additional one.
Absolutely.
Right, so it is of all Eastern Health is the rural component of all Eastern Health.
Sure.
And it has 3 hospitals, Carbonear, Clarnville and Buren.
Right.
And it's got will have eventually 7 family care teams.
Oh, okay.
And then you've got Central, obviously, which has got Gander and Grand Falls as hospitals, a myriad of Category B institutions, and another, I can't remember exactly the number, 8 or 9 family care teams.
Okay.
And then you've got Western, which has got 6 or 7 family care teams. Cornerbrook Hospital is the major hospital, but it's also got facilities in Port aux Basques, Stephenville, Port Saunders, and Bombay.
Okay.
Right then, and then the final one is Lab Grenfell Health,
Right.
where you've got Labrador with Happy Valley Goose Bay and Labrador West, and then associated with Grenfell, which is in effect St. Anthony, and its outreach to various components of the Northern Peninsula and the South Coast. And so they end up both with hospitals and family care teams as well,
Right.
with the added complication that they have 3 nations, indigenous nations,
Right.
Nunatsiavut, the Innu Nation, and Nunatukavut.
Right.
So that piece, how you deliver care to them is very important.
Absolutely. Right. Thank you.
And you talk a lot about the family care teams, and I'm very happy to say that I am now a patient of one of the family care teams. I moved home from Alberta in 2021 and without a primary care provider, and just recently I've been added to the family care team, so it's great. I do have a primary care provider who's a nurse practitioner, so it's great. So what can you identify from the CEO perspective as being the greatest challenge facing public health care?
Well, I think the problem, I think, is that we're challenged by all components of it. So you've got people say, well, deal with the low-hanging fruit. But there may be some, but if we don't have a proper community sector with family care, family practice, and the other pieces of it, which are virtual care and an ambulance system,
Right.
if that's not working well, we got a problem. And then at the hospital level, if the emergency room is not working properly and there's overcapacity of the beds, and there is we have too few beds for too many patients, and we get offload delay at the emergency room, and we get people in corridors in the hospital. And that's not a simple thing to solve. And then you got a ALC, alternate level of care, occurring in the hospitals because of access to long-term care or personal care homes. That's a problem. And if you don't have home support, which is what the seniors want, they want to live in their homes and they want to age in their homes, that's another problem.
Right.
So it's a multifaceted situation, and we have to deal with each of those components as well as we can. And that's why it's difficult, I think, that there's so much change has happened in a short period of time. I think people find some degree of difficulty with it. And then you've got these kind of what I call the connections or the pathways that are necessary to be present for the system to work well, like the ambulance system,
Right.
or the health information system,
Yeah.
or a learning health and social system, which uses data to make decisions. All those things are necessary. Otherwise, we don't provide a modern service. And it's all got to be linked to the social determinants of health,
Absolutely.
which is from NLHS services is related to public health.
Right.
And then you've got public policy around what you do about the social terms of health. So to think that you can take down one piece and correct that, everything is not reasonable. We end up to be able to change health outcomes. If we don't act on the social terms of health, we won't get an improvement in in life expectancy. And if we don't improve the community sector,
Right.
then you've got people using the hospital sector
Absolutely.
too much, and then the hospital sector gets gummed up and it
Yeah.
doesn't work properly.
Absolutely.
So it is a multifaceted problem.
Yeah, and I can see, when you're looking at that, such a large thing to be able to fix, and I guess breaking it down into more smaller pieces, and working on and collaborating together. You mentioned that as well, and going back to, we always link a lot of our conversations back to our standards of practice and how collaboration is so important in the best interest of the client, and even at that systems level as well. How that collaboration with different departments and
Right.
different elements of the whole healthcare
and
system.
when you bring up standards of practice, like you've
Yeah.
got the challenge is to balance risk.
Yeah.
Right, because the one I'm dealing with at the moment is if people are getting care in corridors, that's a risk,
Right.
Yeah.
big risk to us. And then if there are beds available in the Janeway and they don't want us to use the beds because they say it's a children's hospital, where does the balance of the risk weigh out, so to
Right.
speak? So another example would be an emergency room in say Brookfield, where they
That's my
have no
hometown. Sorry.
they have no doctor and they have a nurse.
Right.
Yeah.
And the nurse is not able to put an airway in.
Absolutely.
That's right.
Do you close down the emergency room?
Yeah.
Because 99% of the people who turn up to that emergency room will get reasonable care, and the likelihood of getting somebody with an airway problem is actually really small.
Right.
And an ambulance wouldn't have to take the patient anyway. So the balance of the risk
Right.
is either no risk to the nurse who's looking there, but the patients carry all the risk because they've all got to go to an emergency room 2 hours away.
Yes.
Yeah.
Or, yes, we're prepared to accept that risk while that nurse is going to get trained about how to put an airway in
Right.
over time.
Right.
So that piece of balancing risk, we're not really that good at. We end up with we tend to take no risk.
Absolutely.
And that limits our capacity to solve problems then.
Right. So, Dr. Parfrey, I grew up in Grand Bank. And so I was used to a cottage hospital where we had lots of physicians. You go to the hospital, you got your care, and as healthcare and time passed, there was challenges with recruitment, and so. And now, with the changes and, emergency and outpatients having to close down and that, are you finding the expectations of the public a challenge as well? Because people were used to having a most responsible provider or going to the hospital and getting care, whether it was at a CTAS 1, 2, 3, or if it's like something that your family care provider could handle. So are you finding that public expectations are a challenge for you as the CEO or for Newfoundland Labrador Health Services?
Well, I mean, when you get publicly funded healthcare,
Yeah.
the expectation is you get everything.
Yes.
And as it gets more advanced and there are more shiny toys,
Right.
people think they should have them. And if they can't get if when CTs came in, they wanted CTs. If MRIs came in, they wanted MRIs. So public expectation will never go away.
No. Okay.
So then the challenge, I think, is that demographic change is a massive effect.
Yes.
So if you're taking your hometown,
Yeah.
it's gotten older,
Absolutely.
and there's urbanization. So you left,
Yes.
right?
I did. Yes.
and you
Absolutely.
and you didn't go back.
Nope. That's
And
right.
So they're now without a nurse that you could have been.
Right.
And the expectation is that somehow we're going to attract people your age to go the opposite direction.
Absolutely.
And it's not. It doesn't happen like that.
No. That's right.
And then the population dropped. There's probably a 30 or 50% drop in the population in Grand Bank.
Yes. Absolutely.
So the capacity of the community to be able to support the
Yes.
type of services they had in the past is much more limited.
right.
So therefore, we end up having to think of innovative ways to be able to overcome those demographic changes.
Right. So it's good to know that there's there is a light at the end of the tunnel, that we do have strengths to build upon. So
Yes.
that's great to hear. Okay, so that concludes part one of our episode, a conversation with the Newfoundland Labrador Health Services CEO, Dr. Pat Parfrey. Thank you, Dr. Parfrey. And thank you to our listening audience for tuning in. Stay tuned for next week, when there will be a continuing conversation with Dr. Parfrey. Remember, all episodes of this podcast can be put towards your continuing competency requirements. And also remember to subscribe to our channel, and we encourage you to review, like, and leave a comment wherever possible. Thank you.
Thank you. Thanks, Dr. Parfrey.
This has been a presentation of the College of Registered Nurses of Newfoundland and Labrador.